Okay, let's take a look at these expressions. So the first one is 노심조사. Labored mind, too much thinking. Okay, no means labored, 심 is heart, 조사, thinking about all things. Too much thinking about too many things. Okay, so the 태음 individual, if you remember, this is a reflection of their 정 emotion. What's the 정 emotion of the 태음 individual? 낙, or calmness, okay, motionless, okay, relaxation. So the 태음, what they may do is they may just think about what they want to do. They think and they think and they think more about it, but it's very difficult for them to take action. So what happens is their 정 emotion explodes, okay, or the 정 emotion sinks, and when it sinks, it weighs down their body, and so all they can do is think about action without actually taking it. And this is something that you see in, for example, the depressed 태음 individual who feel like they cannot do anything, that their body just feels like they're bogged down. So, and then the next one we have is the 누모성자. 누모성자. Nu is the character for frequent, okay? Mo means plan to do something. Song means success, and ja means the person who plans to do many things without getting success. So this without, I forgot the without character, is this one. 부 or 불, okay? So it's 누모 불성자. 누모 불성자. 불, this character means without or not being able to, okay? So there's a lot of planning going on without succeeding, okay? So again, this is again a reflection of the 낙정 or the excess comfort. In other words, they are planning all these strategies, but they have not started. They have not carried out, they have not manifested, which is also what song means, manifested their plan, okay? So this is another common trait for the 낙정 sinking 태음 individual, where they have all these plans without fruition. Now, let's go back to the soul individual. There was an expression we used for the soul individual which was very similar to this. It is 개궁역걸. 개궁역걸. What does 개궁역걸 mean? Well, this 개 is also the character we use for 계획 in Korean, which means to plan, okay? And gung means stuck, okay? And 역 means energy. 걸 means bent. So exhausting one's energy through attempting to carry out one's plan. Where do we see this? Where do we see this? We see this with the soum individual's 정 emotion, which is, we see this with the soum's 정 emotion of heat, which is joy, okay? Joy. So if they cannot contain their joy, what does that mean? Well, it means that the soul individual has trouble with practically carrying out their plans, okay? Because if they have something in their mind, that something may produce so much joy for them that their ideas then become trapped around it. So almost like they're becoming lofty ideas. Ideas like a daydreaming ideas, okay? So this particular 개궁역걸 is the soul individual who doesn't have trouble moving, getting started, but has trouble with making their ideas more practical, more realistic, the ability to carry through. So if a soul individual has an idea which he or she has trouble carrying through, they get stuck because no matter how much they try, they cannot succeed, okay, with an idea that is not realistic at the onset or not practical. So this joy, if the soul cannot control it, it becomes more like a utopia-like way of thinking or unrealistic way of thinking. And the soul individual can become very sick if they keep trying these lofty ideas and cannot carry them out. So it's different than not being able to get started, which is this comfort zone. Then it's different than the not being able to get started, the comfort zone. So this joy, again, you can think of it as when it's not balanced. What is non-balanced joy? It is lofty thinking, okay? Overjoy, or a wild imagination, okay? So, for example, this home individual who wants to succeed in their life, say they want to become, they want to be a successful doctor, for example, okay? Well, instead of studying really, really hard and trying their best, they may imagine themselves as a doctor without doing so, okay? And try really, really hard any way possible to become a doctor other than the most practical route, which is taking the very first step, doing good in biology, doing good in chemistry, etc. They just want to imagine themselves as a doctor, and they, with such a strong imagination, want to become one right away. If a TAM individual experiences 3 to 4 bouts of nocturnal emission, okay, this nocturnal emission is due to liver heat and the phase-out syndrome. Remember the lung drying out syndrome? So the TAM individual, as the TAM gets weaker, they will experience phase-out. Okay, so there's many situations where the TAM will experience phase-out. But usually it's from heat burning up the fluids, as we talked about before. So what kind of what type of situations can the TAM experience phase out? When they're getting weaker from heat. So a TAM individual who has trouble finding their joy, trouble finding comfort, eventually they might start experiencing high blood pressure, headaches, things like this. They might get exhausted. Any type of deficiency sign tied in with heat-related sign usually is a sign that they're starting to experience fades out. Now, fades out is not necessarily permanent. In the beginning stage of fades out, it can be lung dryness. It can be reversed. But if it goes on for a long period of time, fades out becomes a serious illness, okay, of weakness of the lungs. So this is the TAM individual who's starting to feel deficient after working really hard, is feeling stressed, might start to experience deficiency-related symptoms like nocturnal emissions, exhaustion, dryness of the skin, for example, wounds that have trouble healing, anything that you would consider now becoming more of a deficient sign. If there is 1 day of constipation, then 열다한소탕 with dahwang should be prescribed. Now remember, 열다한소탕 with dahwang is 청패사간탕. Here we go. We've seen this several times because it's a very common formula to use for heat syndrome of the TAM individual. Okay, so 열다한소탕 plus dahwang is 청패사간탕, clearing heat and also releasing the bowel to clear so that yang can rise smoothly upwards again. Okay. Open the lower gate so that yang can flow smoother upwards. Okay. If the stool are soft and flowing regularly, then 열다한소탕 with 롱구, or 공진 후건단, or 녹용대보탕 should be prescribed. I have thorough experience treating this illness, and as it occurs much more often than one would imagine. Yes, it does, indeed. Even in the modern clinic, you see nocturnal emissions as being a serious, a common illness among the TAM individual. Okay, so 열다한소탕 in plus dahwang, 청패사간탕, is used for the least deficient TAM individuals. So they're just starting to experience nocturnal emissions. Otherwise, they may have some other heat signs, not much deficiency or any deficiency signs other than nocturnal emissions overall. 녹용대보탕, as we talked about before, is for the deficient TAM individual. Okay, deficient TAM individual. So we're going to see more deficiency signs as we talked about. For example, a TAM individual who has experienced more heat-related symptoms, chronically heat-related symptoms, but now are starting to experience some deficiency symptoms. So more than just the nocturnal emissions, or has had nocturnal emissions for a longer period of time. They may also start to experience dry skin, shortness of breath, palpitations, some other phase-out lung dryness syndrome symptoms. And then, of course, we have Gongjin Huguandan. And Gongjin Huguandan, as we talked about before, is very similar to Nogyeongdaebotang. Plus, this particular individual may have some yin toxin. Remember, yin toxin, when it accumulates in the tail individual, it's a very, very serious situation. And so we have Jiqiao and Shijiang. Okay, so if this person experiences nocturnal emissions, also this might be because there's yin toxin accumulation inside and yin sinking down. So what is nocturnal emission? Basically, it's sperm releasing from the penis at night. It could also be female, so also we're talking about leukorrhea at night as well could be the situation we may see in women, excessive leukorrhea. Okay, so when do we experience this? When our essence is sinking at night. So this is yin energy sinking. We need to treat this by helping yin energy descend smoothly and supporting the weaker organ of the tame individual, which is the lungs, right? So also, as we Jiqiao and Shijiang may be used to help release this stuck yin within the body and help the nocturnal emissions. Okay. Among the various illnesses of the tame individual, there is one referred to as zhongfeng. One way of thinking about zhongfeng, zhong means getting inside, okay, and feng is wind. So we're talking about maybe cerebral infarction, stroke, okay. Generally you see this in cerebral infarction and stroke patients, okay, where wind has gotten inside and is stirring interiorly. When it stirs in the interior, then it creates symptoms like hemiplegia, okay, and also gasping for air with audible wheezing and staring into space without recognition of one's surroundings, so loss of consciousness, okay? This illness should be treated with Gwaje-san. Now what's Gwaje-san? Gwaje-san, the Gwaje is the Korean pronunciation of Gwa-di. And Gwa-di is melopediculus, so it is the upper part. Okay, pretend this is yellow, okay? So this part right here of the Asian melon. An Asian melon is a melon that is small enough to fit in the palm of the hand. It's yellow and it has some white stripes down the sides of it. And we're using the pedicle of that melon, which is very, very toxic. And what it does is it immediately causes vomit. So vomiting out the toxin. Okay, this wind is entering the body. Ijema says, well, what we need to do is get it out as soon as possible. So Gwa-di is used as an emergency to promote vomiting, getting the wind out or the pathogen out of the body as soon as possible. Okay, so that's what he uses Gwaje-san for. If the hands and feet are stiff and contracted and the eyes remain shut, then Wuhang Chongxingwan, okay, Wuhang Chongxingwan should be prescribed. So since Gwa-di is very, very toxic and only used in case of emergency after this happens, directly afterwards, you don't see it used much in the clinic. What you do see used much, much more often, and in Korea they actually have a patent of this which is prescribed pretty often. You have Wuhang Chongxingwan. So welcome to Wuhang Chongxingwan. Wuhang Chongxingwan is very similar to Niu Huang Jingxiwan in Chinese, which is used to revive an unconscious patient. So it's either poured down the person's throat until they cough, or administered intravenously. So it is commonly used for stroke and for unconscious patient or conscious, somebody who's fading in and out of conscious. It's a very, very long formula, and what you see in this formula are herbs that help strongly descend yin and disperse this yin toxin, disperse and release and push out this wind within the body. Okay, so that's what these herbs in general do. It's not a commonly seen formula in the Sasong medicine clinic. Because you're not really trying to save people's life in the clinic unless you run an emergency room. Why is this herb patented and pretty common in Korea? Because it helps. It's like a power drink, if you will, for the Taeyam individual. It stimulates the thought process, stimulates the function of the brain, and it's just basically like a bunch of caffeine for the Taeyam individual to revive them. And there's some herbs in here that you don't usually see in general, and they're usually replaced with other herbs on the market. So of course, Pu Huang helps promote blood circulation of the Taeyam individual. Shan Yao strongly supports the lungs. Ji Jiao, which is the rhinoceros horn, you definitely don't see that prescribed in the modern day clinic. It is usually replaced by nogak, which is a dried deer antler. Okay, Zua Tohuangjuan is dried soybean sprouts. Okay, Maimendong, Huangqin, Jiegung, Xingnen, Yuhuang. Everything from here, Maimendong to Xingnen, is accessible, and what they do is either support the lungs, clear heat, Huangqin, from the liver, or descend yin, Jiegung and Xingnen, okay, clearing phlegm from the lungs. Yuhuang is calculus bovis. This is the calculi of the gallbladder of the cow. So we're talking about gallstones, gallstones of a cow, okay, which still used today, bovine parts, okay. Lingyanjiao is Longnao, Bromelium, Shejiang, Baiyan, and Jinbao are all, these last four ingredients are very, very good at clearing the toxin. So dispersing, ridding the body of yin accumulation, yin toxin. So it's a very, very long formula. It has a lot of different herbs in it, and it's good to revive the Taeyam individual. So as I talked to you about before, there's a patent in Korea that has Uang Chongqing It's very, very popular. I have a personal experience that I'd like to share with you. My grandma suffered from stroke, and as soon as I heard this, I rushed to her side, and she was in the hospital getting the feeding tube getting her food through a feeding tube. And I asked the hospital if they would be willing to, through the feeding tube, inject this Uang Chongqing patent. And they finally agreed to do that. We had to get through some red tape, but they finally agreed to do that. And my grandma, she gained her consciousness back, and this was a very tearful moment. So we were able to talk with her and communicate with her after that for quite some time. Let's get back to this paragraph. If the hands and feet are stiff and contracted and the eyes remain shut, then Uang Chongqing should be administered. Those with the above symptoms who originally have a yellowish, darkish complexion will have a tendency to stare into space without recognizing their surroundings. Stare into space, so the eyes are open. If the eyes are open, open is yang. If the eyes are closed, closed is yin, okay? While those who originally have a whitish blue complexion are prone to keeping their eyes closed. Whitish blue, yin, okay? Reddish complexion, yang, right? Reddish complexion, eyes open, yang. Bluish white complexion, eyes closed, yin, okay? If an individual originally has a whitish blue complexion and experiences contraction and inability to straighten the extremities, it is considered an emergency situation, calling for Uang Chongqing. Okay? This formula, as it was prescribed by many doctors of the past, always yielded incredible results. Now, incredible results doesn't mean that it completely reversed the symptoms of stroke. I'm sure that it could have in some situations, but it definitely could help revive the consciousness in most situations. Those who stare into space and experience sudden convulsive episodes tend to die slowly, while those who do not open their eyes and experience sudden compulsive episodes die more quickly. Just because the former situation is slightly less acute, it does not mean that treatment can be delayed. So a yin zongfeng situation is definitely more acute, more serious than a yang zhongfeng situation. Okay, yang is movement, yang is flow. Okay, so if we have movement and flow, we have life. Yin is lack of movement, yin is cold. Okay, death is cold, so that's a lack of life, right? So yin zhongfeng has a much worse prognosis than yang zhongfeng. However, both of them are life-threatening situations, and if you've met anybody who had a stroke, it definitely affects the rest of their entire life. And many of us don't make it through, especially the older individuals don't make it through a stroke. So it's a very, very serious situation. Because Wang Chongqing is not readily available in every household, I suggest preparing a powder of 3.75 grams of yuanzhi, shichangpu, which can be placed in the mouth, and 1.13 grams of zaojiao powder, which can be blown into the nose. Okay, so if this person is unconscious, blowing the powder into the nose can be very helpful. So what's zaojiao? Zaojiao is a very cool herb, okay, cool to cold herb, which helps clear phlegm. Okay, so it helps descend the yin, it helps raise the yang. It's a very, very powerful herb to do both, getting the circulation, getting communication between yin and yang established, okay? And it's very good at clearing phlegm from the upper body, okay? And what about Shichangpu and Yinzhi? Very good at clearing yin toxins, so strongly pushing it down and dispersing it so that it dislodges from the body. If the above symptoms are accompanied by spasms of the hands and feet and stiffness of the neck, then it is an emergency. In this situation, one person should brace the individual's ankles while another grasps and shakes his or her shoulders. Otherwise, one person can grasp the ankles and proceed to bend and straighten the legs over and over again. So here's something very interesting. If the Taeyam individual is suffering from stroke, it's a very, very good sign to keep their body moving. Because what's going to happen at that particular situation is so much wind can get in and so much yin toxic accumulation once the yin gets in that the body may never move again, okay? And they may suffer from hemiplegia, which is one-sided paralysis, okay? For the Taeyam individual suffering from stroke, both the shoulders and the legs should be shaken, okay? The So-Yang individual, however, strongly abhors having their hands and feet in this shaken in this condition. Instead, it is suitable to help them stand up and not allow them to sit back down. For the So-Am individual, I recommend having another person help them into a seated position and slowly massaging the hands and feet instead of having others shake their shoulders. Okay? So why? The So-Am individual needs a gentle touch. Okay? For the So-Am individual, they're very, very delicate. So everything should be done softly and slowly with comfort in mind. Remember, that's the song nature of the Soam individual, okay? They need movement, but they need it comfortably and slowly, okay? The Taeyamids will need movement right away. They need as much movement as possible to get this stagnant yin moving again, okay? So-Yang individual have a lot of yang to begin with, so they don't want anybody to produce more yang. It's actually better for the So-Yang to take control of this situation as much as possible before it gets the best of them. So they are the ones that need to be in control. The yang need to be in control. That's why they should stand on their own, okay? And even if they don't want to stand, it's better to just leave them alone, okay? This is true not just for stroke, but in general, for all illness. The Soam individual need that calm and gentle stroking pattern. The Taeyam need to keep moving. And the So-Yang, they also need to be left alone, okay? Too much smothering the So-Yang individual can impede the healing process. And this is true for all illness, okay? The Shijang, or moschus, this is deer musk, is suitable for vomiting and diarrhea if poison is expected. So why would Shijang be used in that type of situation? Because it strongly disperses yin toxin and clears and descends the yin. Okay, so disperses and descends the yin. Shijang is the best herb to do this for the Taeyam individual in Sasang medicine.